Stalking pharmacies or other vaccine sites in hopes of nabbing leftover doses has actually become a way of life for some Americans who are scrambling to get access. While some large sites run by private firms have high-tech tracking solutions for appointments and doses, issues can arise. We've seen it happen, scarcity of vaccines or even no-shows. That is why Dr. B has quickly become a popular website for people looking to get access as quickly as possible. Joining us now is the founder of Dr. B, Cyrus Masumi. So good to see you, Cyrus. Thanks for being with us. I know that Dr. B launched in January, and how many people have already signed up to get matched with a clinic for a vaccine?
It's over 1 million as of this morning.
Wow. Where is a lot of the demand coming from? Is it geographical? Is it a particular segment of the population?
It's actually fairly representative of the entire country. There are patients who have signed up across all 50 states. When we launched the site on the patient-facing side, it was the end of January, and we did it in a call with 86 community leaders, representative of people across the country. And we made especially sure that we were including folks that were from the most vulnerable populations that have been the most ravaged by the virus, so the Black, the Brown, the Hispanic, and the Native populations. And it wasn't until yesterday that we've actually started talking to the press about it.
Cyrus Anjali here. Obviously, as a former CEO of ZocDoc, the appointments is not something new for you, but talk to me about the sort of any barriers that you might have run into or the difficulty in coordinating with all these sites and ensuring that you get the notifications. What has that experience been like?
So in order to work with any vaccine site in the country, the app is very simple, and any vaccine site can use it. It requires no integration. And so the only thing they need to do is indicate to have a mobile phone and to indicate how many doses they have and when they expire. And everything else in the background is handled automatically by us. We go through and message the appropriate number of patients until every single dose is spoken for.
I know that when we're talking about some of these pharmacy chains or retailers, there have been some questions about whether or not they're willing to give that information. Have you run into any issues that way at all?
Well, the way that the site works, we're getting the information directly from the patients. So people who want to be prioritized through Dr. B go in and fill out our form. We have been very transparent about the fact that we do not sell this information. We will not sell this information. We're only using it at the patient's direction, and we only share it when the patient chooses to claim a vaccine that's allocated to them. Obviously, patient privacy is something that's super important across healthcare. We took it very seriously at ZocDoc, and we take it equally as seriously at Dr. B.
I want to just confirm for folks that using your website, Dr. B, to find a clinic for an available vaccine is free, right?
It is free. It's free for patients. It's free for providers. And what we're telling folks is they should try to get their vaccine appointments the same way they would normally get it. This is a plan B. This is a backup option. You mentioned earlier in the segment patients canceling their appointments. What we've seen is that patients are canceling and no-showing 20 to 30% of the time. And that's resulting in the scramble that's happening at vaccine sites all across the country, and it's resulting in potentially suboptimal allocation of vaccine. And this is what this initiative has been built to do, to improve the efficiency and the equity of vaccine distribution.
Okay, I think it's great that it's all for free, but at the end of the day, this is a business that you're running. So talk to us a little bit about the business model and how do you plan to make money?
Look, I think that right now we are dealing with the problem of our generation. This is our generation's world war, and so within that war, this vaccine is the scarcest resource, and so making sure that it goes to the highest appropriate people, to make sure that none of it's wasted, it's optimally allocated. That is a priority for us domestically, and that is a priority for us globally. The whole world is not supposed to be vaccinated until 2023. And that means that the 2,500 mutations that currently exist of coronavirus are going to continue mutating until 2023. And so this is just my attempt to use the knowledge and the resources that I have to make a difference. And so we're heads down on doing it in as many places as possible for now.
That definitely sounds like a longer term plan. Going forward, you anticipate that this is going to be able to roll out in other places, but and I noticed that specifically on the site, it talks about if someone doesn't have the ability to get text messaging, how to go about doing that. So have you thought about other low tech outreach or other ways to kind of get people in who may not have access to the internet or to text messages?
Absolutely. We have been reaching out to community partners that have field organizations that can go out and recruit those patients and help bring them onto the platform so they can benefit from it. And so there's an ability for people to actually use the app to sign up other individuals other than themselves. And so we've enabled that functionality from day one to make sure that it's accessible in as many use cases as possible.
And moving forward, do you anticipate that this is going to be something that a larger number of participants from, not from the user side, but from the places that you're getting these appointments, the notifications, are you anticipating a larger feed-in? Because I know there are a lot of other startups that are looking at this space or have already launched sort of in portions around the country.
We'll work with any vaccine site that needs our help. We have well over 200 vaccine sites that have come to us across 30 states that have asked to be turned on. And to be clear, thus far, Dr. B, patients can sign up anywhere. The initial pilot states that we've started with are Arkansas and New York State. And so we're trying to get to all 50 states as quickly as possible. And any provider that wants to use us and wants to be notified when we launch their state simply can go to hidrb.com and fill out their profile, and we'll be in touch shortly.
You know, after we're all vaccinated, and hopefully that is sooner rather than later, do you see Dr. B continuing to exist, and what form might that be? What might it look like?
Well, I think, as I mentioned, the world is not going to, even by the end of this year, the world will not be vaccinated. The US may be vaccinated, but this is a world pandemic. This is not a US pandemic. As it relates to the US, there are already clinical trials that are going on for booster shots for the vaccines that have already been delivered. And as you can imagine, if we don't have enough initial vaccine for the world, having enough booster shots is going to create an issue as well. So we want to be helpful for as long as we can be helpful, and doing our part to solve this problem for everybody.
All right, Cyrus Masumi, founder of Dr. B, thank you for the work that you're doing, and also Yahoo Finance's Anjali Kamlani. Thanks for joining us.